Hi everybody, Dr. Sunil Dand, internal medicine physician. Doctors refusing to see patients who are not vaccinated against COVID-19. We recently had a high-profile case of a physician in Alabama who was declining to see patients who were unvaccinated. Within the last couple of weeks, I also heard from a trusted contact in the northeastern part of the United States who said that her physician had written to all patients saying that she would no longer see patients who were not vaccinated against COVID-19. And let's be clear here, I do believe that these numbers of doctors are very small. I obviously work with a lot of doctors every day in my regular work, and I haven't met a single doctor who has said anything even close to refusing to see patients who are not vaccinated against COVID-19. Nevertheless, it is becoming more of a discussion, especially in the online realm, and it only seems set to grow as a topic over the next several months. This is actually a topic that I feel very strongly about because I feel it gets to a core of the Hippocratic Oath and what it means to be a doctor. And I'd like to share with you a quote that my uncle once sent to me. Doctors are subject to certain professional obligations. The Hippocratic Oath demands that they treat everyone to the same high standard regardless of gender, nationality, religion, or politeness. They must even afford the same standards of care to a murderer and the victim's family. Sometimes this must be challenging, sometimes it must seem unfair, but they have a duty, one that must be done without prejudice or discrimination. I can't say who that quote is from, but I think it is a fantastic quote, whoever wrote or said it. It gets to the core again of the Hippocratic Oath and what it means to be a physician. We never judge our patients, we never discriminate against them or show any type of bias to any patient who is asking for help. Leave the judgment to God. We are there to help our patients always. And think about it, if we're talking about the hospital, for instance, I can think of lots of times where prisoners are brought into the hospital. This has happened to me a number of times, including last year during the COVID-19 pandemic. We frequently see patients who are chained or handcuffed to their beds. They may be surrounded by police officers. They could be murderers. They could be rapists. They may have committed the most heinous acts. They could be terrorists. Nevertheless, we do our job to the best of our ability. Even before patients register at a practice, an outpatient practice, you don't have the doctor or secretary ask the patient for their criminal history, do we? A decision regarding being vaccinated is something that we as physicians can only help guide through education and gentle persuasion. And I'm thinking even of my own experiences over the last several months. I've talked to lots of patients, and some conversations in particular stick in my mind where I've talked to patients who are in high risk groups. They may have advanced lung disease, they may have diabetes, and I've told them quite clearly that the benefits of being vaccinated far outweigh any risks, and they have declined to be vaccinated, and I've looked them in the eye and I've told them sincerely that I believe they are making a mistake. But I don't get angry with them visibly, I don't get frustrated, I don't throw a tantrum. I accept the fact that in the end they will make a decision, and maybe next time I see them we can talk again, but it will be their decision. They will walk through the door. Nothing for me as a physician ever comes before informed consent. We don't coerce patients to do anything. We don't force medical treatments or therapeutics or interventions on patients. That is not what we do as the medical profession. We are there for education, gentle persuasion, and the right guidance. But in the end, as I said, adults will make their decision. And the truth is that people make decisions all the time which may be bad. Some adults may choose to drink a lot of alcohol. Some adults may smoke 1 or 2 packets of cigarettes a day. Some may do drugs. Others may choose to ride a motorcycle in a dangerous way. But if they come to us asking for help, we don't judge them or discriminate against them, or worse still, refuse treatment. That is not what we do as physicians and the medical profession. So what I would say to any doctor out there that is thinking about declining treatment to someone because they are refusing the COVID-19 vaccine, I would say 2 things. One is, have you ever heard of the Hippocratic Oath and what it means to be a physician? And number 2, you should take a long, hard look in the mirror. Thanks everyone for listening. Dr. Sunil Dand, MedStoic Lifestyle Medicine. We will speak again next time.